couple friends and folks that I know respectively from the community who are out in the front lines doing good work and taking care of the populace here, not only in the Eastern Panhandle, but in the Northern Shenandoah Valley as well. So with us today, Chris Rucker, who is the VP of Strategic Services for Valley Health and also the President of Valley Health Systems. And we have our speaker today, who is Mr. Mark Nantz, who is the new President and Chief Executive Officer of Valley Health Systems, a not-for-profit network of hospitals, services, and providers based in Winchester, Virginia, as you may know. Mr. Nantz comes to the position with a wealth of knowledge, I think you'll agree, in the healthcare industry, having served in executive roles for more than 3 decades. He brings a dynamic track record of instituting organizational effectiveness and strategic business plans at the local, regional, and system levels for several other large healthcare organizations as well. Most recently, he has served as the Chief Administrative Officer and Atlantic Group Interim President for Bonds. You're going to have to help me with that name. SCORE, Mercy Health, serving 14 hospitals and related in-market services in South Carolina, Virginia, Maryland, and also Florida. There he developed and implemented new HR and IT applications and an organizational redesign model. Prior to his service with multiple positions at the Atlantic Group, including serving as the Executive Vice President of Strategic Growth, he served as the President of the Carolinas Medical Group, where he led all staff, credentialing, and quality issues for their organization. During his tenure, he directed all financial matters, supervised all nursing operations, including the Jeff Gordon Children's Hospital, and oversaw philanthropic activities associated with donations to the system's foundation and their medical center. Mr. Nantz holds a master's in health administration and a Bachelor of Science in accounting. He is a CPA and has been named a fellow in the American College of Healthcare Executives. He has volunteered in numerous nonprofit and civic leadership capacities, including several terms on Medical Center Board of Directors, Chambers of Commerce activities, and has provided supports for the arts, Red Cross, and the March of Dimes in several communities during his tenure. Mark and his wife Courtney have 3 grown children, which he just told me about, and Courtney works in higher education. Together they enjoy sports and giving back to their respective communities. In his spare time, you will find that Mark is on the ski slopes and enjoying art and music local events. Please help me welcome Mr. Nantz to Rotary today.
All right, so I'm gonna see it. So how is this? Does this look pretty good for you guys? Okay.
That's good, yep.
That introduction sounds like I can't keep a job. So in any event, I think what we're going to do is minimize this. I'll take a look at the slides and we'll go through this. My desire would be that this be very informal. Obviously, these days are very different than they were. What a time to get a new job! If you think about it, coming to a new community. I'll tell you this, Chris, how about hitting the next one so we can go to it? That was good.
Thank you. It's all about execution.
We're working through our
Is this the camera?
Yes, this is, yeah.
Yeah.
Hey.
There we go.
So I thought I'd take us back to the day, the week before the entire world changed. This is me on a ski slope in Colorado, the day that Joe Silo, the chairman of the board of Valley Health System, called me to offer me a job. And as you can see, I was a pretty excited guy right then. I'm still pretty excited in spite of all the things they didn't tell me about the new job. But a friend of mine had the presence of mind to take that picture, and it just kind of captures the excitement I have. I can tell you that 6 months later, through COVID, I'm still that excited about being here, about the work we're doing at Valley Health. So, Chris, if you'll advance that. Just a little bit about me, tell you my connection to the area. I've just to kind of share personally with you. about 2 years ago, I found out, I found my first family. I'm adopted. I was adopted at birth. Mom and dad raised me in Charlotte, North Carolina. But with the advance of testing, DNA testing kits, both of my daughters wanted me to figure out my family history. They wanted to know the medical history because they're both childbearing age. Actually, two grandkids. And so my oldest daughter really much encouraged me to find my birth family. And so I found my birth family. And I found out that my mom was 16, my dad was 17. I found out that they were never married. They were only together for a very, very brief time. And I found out that my mother never told my father that she got pregnant. And that was back in the day when, you know, a young lady might get pregnant, get in a situation, and they would send her somewhere else where she would take care of a sick relative for 6 or 7 months, and then she'd come back. And that's exactly what happened. They sent her to a place called the Florence Crittenden Home in Charlotte, North Carolina, which is where I was born. And so they sent her to the hospital that I got my first job at, Carolinas Medical Center. They sent her to the hospital where I had my first daughter and where I had my second daughter. And where my daughter later volunteered at Florence Crittenden Home when she graduated from nursing school. And so I say all that to say, when I met my birth mom and my birth father for the first time, I didn't have to go too far from here because my birth mother's from Falling Waters, West Virginia, and my birth father's from Hagerstown. So, you know, a lot of things happen serendipitously or providentially is the way I look at it. But to meet them a couple years ago and then be called to serve as the leader of Valley Health and what was essentially where I'm from, I knew there had to be something serendipitous and probably providential about that. So my wife and I feel like we were called to serve here in the Shenandoah Valley, Panhandle of West Virginia, and we're pretty excited about being here, particularly because the values, the mission of Valley Health. Our mission is serving our community by improving health, and that aligns almost perfectly with what I want to do. I'm in the latter part of my career. So I come to work every day to serve our community by improving health. And that includes, obviously, the communities of West Virginia that we are so happy to be part of serving. So, you know, our goal is to drive for great quality, engaged employees, and focus on high reliability. You know, again, just that you can trust what you're going to get from us. So, Chris, if you'll advance the next slide. So you can't really talk about healthcare right now without talking about the pandemic. I was talking to some folks here, and I was listening to some news anchors yesterday, day before, and it took us, and we're over 10 million cases. It took us 9 months to get to 9 million, and it took us 10 days to get to 10 million. So that's, you know, just to give you an idea of how fast. And I know for a lot of folks, that's just numbers on a screen. But for healthcare workers, it's putting us in a situation where we think we're ready, we think we're prepared, but at those levels, I mean, it could overcome what our capacity is. So I would be remiss in not telling you that wear those masks, wash your hands, stay 6 feet apart, and I know that's going to be really, really difficult during Thanksgiving and Christmas, and it's going to be really, really different and weird for us. But again, I think I have to make that public service announcement every time I talk because it is a real thing. Speaking of back to my birth family, I actually got to meet them all, and I actually have a 95-year-old maternal grandmother still alive in Falling Waters, West Virginia, still lives on her own, and she had COVID. She got COVID 2 weeks ago and was in intensive care. And darned if she didn't beat it, and she's back home. So she's one tough cookie. There's no question about that. But again, half that part of the family's had it at this point in time. Our goal right now is just trying to protect and support our caregivers while we protect and support the community. I will tell you that if you have somebody who's in the healthcare business in your family, you know, be thanking them because our staff was there when it was very beginning. We had that first patient. They have not stopped. And now they're looking, you know, we thought we had a break in this, and now they're looking right down the barrel of the winter, and cases just kind of spiraling out of control. So I'll tell you that we're a lot better at treating it. We know more what we're doing. We know how it spreads. We know what to do to keep it from spreading. So I think you won't see us shut down the elective procedures. I think you may see us, if it gets to the numbers that we were seeing in some parts of the country, you'll probably see us limit elective cases and things like that, but I don't think we'll see ourselves shut down again as we did in the past. So in any event, the good news is I think we have 31 people in the hospital today. None of them are on ventilators. And that is a good thing, because back in April when we had something like 31, about a third of them were on ventilators. So I think we're getting better at treating it. And we're very innovative in healthcare, whether that's at WVU or Valley Health or Johns Hopkins. Our doctors and nurses and other clinicians have begun to very much understand this disease, and hopefully with the vaccine soon, we'll be able to come through much better. My understanding is that the vaccine is going to be here somewhere in the neighborhood of the next 2 weeks. That vaccine there won't be anywhere near enough for everybody who wants it. The challenge will be getting people to want it, because there are folks who might not, but 90% effectiveness probably makes that a little better. And the other part is how much can you get, how fast, and the logistics of actually distributing and administering the vaccine. So there's good news on that, but from what we understand, we won't have enough vaccine to do our at-risk populations of long-term care facility folks and frontline caregivers until probably sometime in January. So we've still got a lot just facing it where we're facing it now. So Chris and I'll take some questions at the end, so I'll stop on that at this point in time. So again, this is an interesting thing is when I interviewed for this job, it was the first interview where I had heard from a board or a search committee. They never asked me about money. They never asked me about how can we make more money, how can we save more money, how can we cut our costs. They talked about quality. They talked about how to highly engage our employees so that they're committed to the mission of the ministry. And they talked about how do we create partnerships in our community, how do we improve health, how do we work on social determinants. It was the first time in my 33 years that somebody didn't say, we need a financial turnaround, or we need to cut costs, or we need to grow revenues. I think we want to do those things. We want to be more efficient, but it really made me, feel very good about the organization I was coming to. Whenever I was called to be here. The other thing that has really impressed me about Valley Health, it's an independent, locally governed organization. We're able to make our own decisions. And we're not running our healthcare system out of a multi-state corporate office in Cincinnati. We're running our community system for our community. And when the pandemic hit, a lot of hospitals and health systems, the first thing they did was furlough employees. They laid off employees, and often they were the lower level employees that did clerical work, that didn't have work to do. At Valley Health, we made the conscious decision that even if there wasn't work for people to do, they would still get paid and get the benefits. Because we can make that decision because these are our friends and neighbors, these are our people, and we had the ability to say, you know what, we're going to stick with our people, because the last thing we need to do is lay off 1,200 people in the Shenandoah Valley as the largest employer. So I was really proud of our board for doing that, because it wasn't cheap, but it really demonstrated, in my opinion, our commitment to the community and just the flexibility that we have as being an independent local organization. Chris, I'll keep going. So a couple things about just why I do healthcare. I mentioned to you that I was born in that same hospital that I got my first job. A bunch of kids were born in there. And when I had my first child, we didn't have insurance and we didn't qualify for Medicare. And so we were students, and so we were placed in the charity ward at Charlotte Memorial Hospital. And I remember that there was a charity ward, and there was there was one labor and delivery suite section, and everybody was in the labor and delivery suite section. But if you had insurance, they sent you to one floor, and if you didn't have insurance, they sent you to a ward where your spouse was in a room with 3 other ladies that had a child, as opposed to being in the private room where the mom and dad were having a steak dinner, and dad had a pull-out bed if he wanted to stay the night. It was his first kid. You know, at the time, I was a college student. I didn't know where I was going to be or what I was going to do, but that had an impact on me as being treated as maybe less than. Now I got good care. I don't want to say that I didn't, but I tell you, it left an impact on me. And when I got to healthcare, I didn't forget that people, you know, people feel either good or bad about how they're treated, and everybody, in my opinion, has a right to be treated fairly and has a right to good health care access. And people shouldn't be made to feel that way, whether they have insurance or whether they don't. I've come a long way from that time when I didn't have insurance, but I've never forgotten that experience and how it made me feel. And it allows me to continue to relate to our lowest paid employees. It allows me to continue to relate to people who come in who haven't had the advantages of being raised and had an education, having food to eat and a place to live, and people who love them and send them to school with full stomach. And so it really kind of formed the way I think about what we do. And when you couple that with the 10 years I spent in faith-based healthcare, where I came to believe that healthcare is a ministry as opposed to a business. And I've come to believe that those of us who serve in healthcare are called to serve. And I believe fully that my wife and I have been called to serve at Valley Health. But I think when you think of it like that, it's not about, just, having more equipment, doing more procedures, making more money. It's about how do we level the playing field, and how do we make sure that everybody's got an opportunity, and how do we make sure that your health is not determined by the zip code that you live in. Or the amount of money that you make. So my last 10 years, my last decade is really about how do we improve the health of our community? How do we serve our community by improving health? And it's actually liberating to come to work every day when that's what you want to do. So I'll leave that. I could talk about that for a long time, but Chris wants me to talk about something else now. So a little bit of, I did my public service announcement. Now I'm going to do my commercial. Spring Mills, we just opened up that 40,000 square foot medical campus. Again, our timing wasn't great on that, given right in the middle of the pandemic. But we're getting our footings, and so we've got a lot of primary specialty care up there. So my commercial is please choose us. So other thing is, just to give you an idea of what we've got up this way. We've got urgent care, we've got family care, family medicine, we've got internal medicine, all of Spring Mill. So again, that's the commercial part. I got to do that. Chris won't let me speak without at least doing some commercial. What do we see going forward? I think one of the things that's going to come out of this pandemic is the need for the healthcare system and the public health departments to continue the cooperation and collaboration we've had. A lot of this wasn't in place because we hadn't had a pandemic in a while, and nothing to this extent since way back in the early 1900s. But just the public-private, public health partnerships, they have to be good. The lines of communications, we've got to be able to communicate with one another to protect public health. And so I think you're going to see a lot of investment in that. I think you'll see the federal government do that. I think you'll see state government do that. And I think you'll see large healthcare systems like ours, and of course the university, make sure that we've got a strong link to our health departments. And we'll know how to distribute vaccines next time. We'll know how to get PPE next time. We'll know what the stockpile needs to be next time. And I think those are lessons that we won't soon forget. I think that, as I mentioned earlier, I don't think this pandemic is anywhere near over. We're not back to business as usual. We likely will not get back to business as usual for some time. One of the interesting things is our emergency department visits are down about 15%, and most everywhere in the country they are down about 15%. There are a lot of people still scared to come to the hospital, or still scared to come to the doctor. And so I think some things may stay this way. I think we've advanced the science of telehealth, of doing things like we're doing right now today. We've advanced that 5 years in the last 9 months. And the acceptance, when we started this, most of our physicians didn't want to do telehealth, and most of our patients didn't want telehealth. And now our patients want telehealth, and our physicians are like, we need to do telehealth. So I think that will stick with us. And I think in some ways that will bring more options for care to rural areas, and maybe help us meet the needs of some who don't have the access, which in my view would really be improving health by serving our community by improving health. So I think a lot of those things are gonna stick with us. I think, you know, health systems are going to continue to struggle because a lot of health systems, particularly a lot of critical access hospitals, were on the bubble. And this was the last straw on the camel's back, and they may not come back from this. So I think there's concerns there. But I do think we're going to come through it. I think we've learned a lot. I mentioned that we've learned how to treat it so much better than we did when it first happened. So I think we'll get through this. I'm encouraged by the science. I'm encouraged by the fact that if necessary, we can get to a vaccine in 6 months as opposed to 5 years. So again, I think the future, looking ahead, is a bright future. And I know that, is this our last slide?
Yes, sir.
I know that Valley Health is just honored to be able to take care of a lot of the citizens in this community. It's a very, very important part of our service area. And we'd like to do a lot more up here. There are certain regulatory laws that prevent us from making more investments, but we'd love to make more investments and find ways to serve this community in other areas. But again, we're glad to be here, glad to be part of your healthcare continuum, and I appreciate you taking 15 minutes to listen to me.
Can we take a couple questions?
Yes,
or
absolutely.
Okay,
Yep. Sorry, give me just 1 second.
go right ahead.
Well, I'm going to go ahead and answer the lady's question right here at the table, since she's in the room.
Repeat
My
it.
name's Carol Bailey, and listening on the news, and they talk about the vaccine and the fact that it has to be 7 degrees below zero, and it can't be, it has to be, you can't open a box except for a minute. Is that really true? And if so, how do you actually administer the vaccine under those terrible conditions?
So the question was, I'm going to repeat it in case people didn't hear it. The question was about the vaccine and the requirement for it to be stored at -71 degrees Celsius, which is very cold. Yeah, and that it has very limited life once it thaws out. And Carol is asking, well, how in the world are we going to administer that? And that's part of the complexity of the logistics. And it's also 2 doses. So you have 1 dose, and then 3 weeks later, you have the other dose. It's a lot like the shingles vaccine that people take when they get my age. So the answer to that question is, we have a lot of smart people planning that. I don't know about the 1 hour thing. I'm not as familiar with that. I know it has a very limited life. You know, obviously you can't inject something into your body at -71. So it's got to thaw out, but then it has like, the virus only lives for a short period of time. So it's going to have to be done almost like an orchestra. You know, everything's going to have to be in sync. We have a partnership with Shenandoah University. And Shenandoah University has freezers already that have that capability. And we have a set of freezers coming to Valley Health as well to store it. So they do make such a thing. And so the plan would be that we have plenty of room to accept whatever they've got. And we're working on, with all of Virginia, the Virginia Department of Health, all right, this is how we do it. And it can be done. So they're doing it now in trials, and we're going to model that. But it's not like the flu vaccine is right now. that answer your question? Okay.
I know it's very new, the vaccine. Do you see that being something that's going to need that we're going to need annually, or how often are they projecting that we're going to need to take the vaccine going forward?
You know, I wish I was a clinical person and I could tell you that answer. The question is, I don't think anybody knows at this point in time. We don't have enough history to know whether you're immune forever or you're just immune for the season, whether it's like the flu or whether it's like the measles. So the answer is we don't know. There has been some, but few cases of people being reinfected or retesting positive more than once, but we just don't have enough data to be able to make that with, certainly I don't have that enough data to tell you something that I think would be accurate. So I think the question is we don't know.
Okay.
My question is relative to telehealth, because that's a really big shift for most, not most, but a lot of healthcare systems for sure. Do you think that that would be kind of the standard for primary care moving forward and even between systems?
You know, I think that we've been using telehealth for a lot of years. I mean, I think telestroke was probably one of the first really, really important uses, where if you come into a rural hospital and you think you're having a stroke, they put you in front of a high definition TV and you talk to a neurologist, neurosurgeon in an academic medical center somewhere else and determine whether or not they should administer TPA, which is the clot busting drug that saves people's lives. And we've been doing that for a couple decades. So it's clear you can do important, urgent stuff. It's now, can you do routine stuff? And I think what we found is a lot of that routine stuff we can't. Some things we still got to lay hands on. I mean, a doctor's going to have to lay hands on some people for sure. But a lot of things, like with the use of biometric devices and telehealth, you can watch somebody, whether it's take their blood pressure or whether it's something more simple. We can do drive-through lab testing. We've been doing that. So I think it's going to change. And I think we're probably going to see telehealth become a much, much greater part of the continuum of care, particularly when it comes to, you can do all kinds of primary care sick visits right now. But again, there's still, it's a little bit different because you can't do the quick strep swab, so I think there's some things. I had my first experience with telehealth a couple of years ago, and they misdiagnosed pneumonia and instead thought, I just had bronchitis. And so my first experience wasn't very good. But I think we're getting better at it. I see a lot of opportunity. A lot of rural places don't have access. There's not enough primary care physicians or nurse practitioners. If we can get them broadband internet, that's the other. To make it work, you got to have broadband internet. So the first thing we got to do is get the infrastructure in place so that people can access it. But I think that could create a whole new ballgame of creating access for people in some of the more far-reaching areas.
And how do you think that will, in terms of like reimbursement structures through, insurance and Medicare, Medicaid, how will that impact?
Well, I know.
What's the discussion around that?
So the question is about whether or not, are we gonna get paid for doing telehealth, and will we continue to get paid? I know that the American Hospital Association, I know that the Virginia Hospital and Health and Hospital Association are lobbying hard and advocating very, very, very aggressively, assertively, that we make some of these emergency payments permanent, for the very reasons I just said, to create access to the most vulnerable of our population. So, I think we were already on a trajectory to do more care at home. It's the safest place for so many people, and I think that this is just another reason for us to push that envelope further and faster. And I think at the end of the day, it will probably be better for care in the long run, not worse. I don't think it will reduce the quality of what people get.
Thank you.
I had my first experience with telehealth 3-4 weeks ago, and this was, I had my nose. And I knew I had this is something I didn't. I looked at that and I saw one doctor, showing me the office. I saw some other doctor who was supposed to be the teledocs. Couldn't get the video to work, so she just called me. And I'm saying this only because I could also see it going in the wrong direction, because, so here I am just talking to her on the phone saying, hey, doc, I know this is what I have. Can I please just get the CPAC and Cody Foster, because that's my hospital. Pick it up the pharmacy. I mean, I knew I had that, I'm not just person, but sometimes people can have this and maybe not get it. They're diagnosed themselves instead of doctor. That way.
And you know, again, it's not for everything, and it's not for everybody, but if it can supplement certain things, if we can use it to manage chronic conditions like diabetes, COPD, congestive heart failure, again, using technology like the bike, right now I can tell you what my blood pressure is and you know, and how many beats per minute my heart's beating. If we can, you know, harness technology to monitor that data without invading people's privacy, but you know, we can remind people, hey, your pulse is higher than it needs to be, or how about call them up? How about stepping on the scale? I want to see if your diuretic might not be working. So there's so many things that we can do proactively that would maybe prevent hospitalizations or and preserve life. So I think we just got to use it in the right settings. And I don't know that we're there yet, but I'm really excited and encouraged about the technology. And again, we got to get paid for it. And that's, you know, and we can't let the quality slip just because it's virtual. Yes, sir.
My question is, so the new challenge to solve the pandemic here, and the fact that we had CEO changes with the 2 major health players in our region relatively at the same time, do you see any changes that there being more collaboration between the Valley Health and the WMS system, or there's still too many people guard and key positions that there's going to be more of a competition instead of a cooperation?
You know, I think that there's room for collaboration. Oh, so the question is, because we've got 2 new CEOs, relatively new CEOs at both the local WVU and Valley Health, that do you think we're going to continue to compete, or do you think we'll collaboration? I think the answer is probably both. But I'm trying to get on the calendar so we can have some conversations to see what we might be able to do together. And again, go back to our mission. It's serving our community by improving health. That doesn't mean serving our community by dominating healthcare. And so we're open to anything that will improve the health of this community. Now, to be sure, we want people to come to Valley Health. We want to do it better and do it well. But what we want to do first and foremost, is what's best for the patient. So if opportunities to collaborate come about so that we can improve social determinants or improve access, and we can do that together, we absolutely would be in favor of doing that.
Mr. Mann, how can we as community leaders direct people to the right facilities and panhandle around COVID, or to things that are going to be supportive of the overall populace?
Chris, you want to take that?
I'd be happy to. Tiffany's question was, how can you as community leaders, Rotarians, help direct people to the right facilities during COVID? That was essentially it. And it's a really good question, because as Mark said when he was starting out, number one concern is healthcare worker safety. You know, because healthcare workers are interacting with so many people, they're more likely to get infected. So we want to make sure that people are going to the right locations. I would encourage you to visit our website, www.valleyhealthlink.com/COVID. There's lists of symptoms there, suggestions to help you identify where to go. Call your personal physician. Call really any healthcare facility. Tell them what your symptoms are, and they will help you, depending on where you are. They'll help you find the right location to go. If that's for outpatient testing, like drive-through testing, as Mark mentioned, or to go to a respiratory care clinic that's caring for people that aren't sure if they have strep or COVID or whatever. So does that answer your question? Yeah, so great question. And yes, there's a right and a wrong way to do it. So it's always better to ask than to stroll in the lobby of your local doctor's office and start coughing everywhere like a lawn sprinkler.
We probably got time for one more, I think. I'm not sure. We got time for one more, or is that? Anybody in virtual land want to ask anything?
I think you guys covered it.
Very good. Well, thank you for the opportunity. I'll let you get back to your meeting, and we appreciate it. And thanks for supporting Valley Health.
Yes, sir. Thank you. Appreciate it.
Thank you all.
All right, great. Thanks, guys.
All right, so anything else for the good of the group? I think that